Calls
Yeah,
me
we
to
can start
order.
the meeting.
Yeah, I'm just gonna go through attendance while Catherine tries to find the host key. So
Yeah, I don't have the host key, so we can get started. Is Laurel our guest here yet?
I don't see her, but it should be here soon. So I'm just gonna go through and say your name. Just when I say, just say here. So Alex Kelton here. Alyssa Toppy,
Here.
Lauren Blois,
Here.
Megan Cohen. She here. Megan Cohen. Oh, don't see her.
Megan has a driving lesson, so she is not.
Oh, okay. Nick Leary,
Here.
Summer Milski,
Here.
Uma Gerwick,
Here.
Yana Herzog.
Yeah.
I'm here. Anthony Mtucci.
Here.
Anthony's here, yeah. Emanuela. I thought I saw her. She's I think she's having internet issues, but she is here. Madeline Bernier.
Here.
Awesome. Jenna Farber. Jen. I thought I saw her. She is here. William.
Here.
Awesome. Amelia Fontes.
Here.
Awesome. Ali.
Here.
Awesome. And Thomas.
Here.
Thomas. Awesome. Okay, so everyone is here except Megan Cohen and Anthony. Awesome. Really good. It's really exciting to see you all here. So now, Anthony, if you could just go through the minutes so we can just like do a quick summary of all of them, approve them. Great.
Yeah, just we can just review what we did last meeting. So we started off by speaking to Mr. Lyons about just kind of honestly just everything going on, sort of in a sense. We asked questions about the Black Lives Matter movement, how that impacts decisions regarding Wakefield Public Schools, and we also asked a lot of questions about certain processes that will take place in order to provide a safe environment going to the fall due to COVID-19. And then from then, we moved on to a liaison presentation by Lauren Blois about essentially just these steps for acting as a liaison to a specific council, committee, or department, and how to go through the process of developing a connection with them. And then you, Jack, had a very nice presentation on the Roberts Rules, just kind of laid out everything about how the system works and its purpose. And I think that is all we did last meeting.
Awesome. Thank you. Do I have a motion to approve the minutes from last meeting on July 1st? Anyone?
I motion it.
Nick, do you have a second?
I second it.
Awesome. All those in favor of approving the minutes, say aye.
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 All opposed, say nay. Okay, it's approved unanimously. So now we should go into public comments. So is anyone here from the public want to say anything? I don't think there is. Let's wait a second. Okay. None. Awesome. So next on the agenda, I just have like a discussion on how like our town department and board committee liaison things have been going. Has anyone had an experience yet? Or are we still kind of waiting? Like, how's it going? It's like open discussion.
I had a meeting yesterday,
Awesome. Who are you with?
the B library.
Oh, nice. How'd it go?
Good.
Good. Anyone else have any experiences that are fun? So I know that I just got my email yesterday for the finance department, so that's really fun. We're just having a meeting, so that's pretty cool. Anyone else have anything going on?
Yeah, I was gonna say I've been in contact with the police chief and the deputy chief, and we're gonna have a virtual Zoom meeting in August.
Awesome. That's really good to hear. Yeah, that's an important one. Anyone else? Alyssa, have you heard anything from the town council? Like,
Yeah, I set up a meeting with Anne a few weeks ago, and I was on their last meeting.
awesome. Yeah, they're really cool. They're awesome. So, no one else has anything. Alyssa has a presentation on constituent engagement.
Oh,
So
let me just, Jack, can I?
yeah, go ahead.
So has anyone not heard from their council, their town board liaison yet? So, because these are, so Amelia, what's your board again?
The Council on Aging.
Okay, did you get my initial email introduction?
Mhm.
Yeah, you just haven't heard back from Judy?
Nope.
Okay, I'll follow up with her. Who else has not heard anything yet? Anthony, I saw an email from Jennifer to you.
Yes, she did, and I sent the email back. She may have just gotten mixed up with the emails and hasn't seen it yet, so I could send a follow-up.
Okay,
Surely.
but she
Yeah.
sent you an
She did, yes.
okay, yeah, I'm just making sure everyone got
Mhm.
at least one response from that person. So Amelia hasn't, anyone else that hasn't heard from their person yet? Everyone else? Ollie, did you hear from the Conservation Commission?
Yes, I did.
Okay, great. Well, I'm really excited. I know, I'm just going to say from behalf of some of the people I talked to, they're very excited to be connected to the Youth Council. So, maybe we can look at in upcoming meetings, having a couple of you guys at each meeting give updates. So we kind of spread it out, but maybe it's something where you email Jack or Lauren if you feel like there's something important for the youth to know about. Okay.
Yeah, awesome. So, Alyssa, if you want to share screen, go into your presentation. That's cool. The sheet's here. Oh,
Catherine, are you
Catherine.
the host?
Okay.
I just got the host code, so give me
Okay.
a sec.
Okay.
Wait 1 second.
Just a second.
What's happening? How's everyone's day going? I'm going good.
Not too bad, thank you. How has yours been?
I'm doing good. I'm doing summer work. AP Lit is a hassle, to say the
Oh,
least.
Reading Moby Dick.
Yeah.
We're doing the Sympathizer. It's just like a thick book, but I'm excited.
Is anyone on vacation right now?
Alice, where are you?
Michigan, Higgins Lake.
Michigan. Wow. Far.
I'm on Cape Cod again.
Ooh. I wish I was on the Cape. But it was so hot this weekend. I was at an event. It was in Somerville. It was like 102 degrees. It was boiling. But I got a little bit of a tan, which was good.
Okay, I am almost ready. I just got the update. Okay.
Technology.
All right. So, and Alyssa, we just need you.
So then you should just give her privileges to share.
Yep. Okay, go ahead.
All right. Okay, I think we're good. Did that work?
Yep. You're good.
All right. So it's pretty short. I kind of assume there's going to be a decent amount of discussion about this, but this is basically just a little presentation on how we can engage the youth of Wakefield and reach out to them to make sure that they know that we're here doing things to benefit them and they can reach out if they want. So a couple of potential methods I came up with is our social media account, like email updates, kind of similar to a newsletter, just for more detail, but I'll get into that later. Some form of a survey, so youth can tell us what they want to see us address. And something just to note is there's already a Gmail set up for us. So that is already done. So the first one is social media. So this is really obviously simple. It's a a lot of youth are on social media, and it allows them to take the information, look at it. They can go back and look at it and just read it and digest it on their own time. And it can also be really useful in the long term, because once, this is very long-term thinking, but once applications for next year roll around, we can publicize that process, and we can pass like the account username and password down as members switch. So just a little more specifics on this slide. Platform-wise, Instagram would be a really good option because just a lot of people are on it. I'm sure most people on this are. It's really simple to use. For those of you who are on it, you know this. And you can put links in bios for surveys or forms, and business account features can also allow you to link an email into a bio, and DMs could also be utilized, but that probably wouldn't be likely. So emails and newsletters, it's also pretty simple to spread information. It wouldn't be a giant email. It would just let us go into more detail than social media would without bombarding people's feeds, just seeing that all the time. Youth without social media can receive updates this way, and it provides the opportunity for people who want to know more than just the basics of what we're doing. They can get a little more information that way as well. So for the emails, it would obviously be opt-in. We wouldn't just start sending them to people. If we do decide to do this, I could reach out to the administration at the Galvin and the high school to see if they would be willing to send out a form to allow students to provide a non-school email address if they are interested in getting our updates. And updates would be probably sent out within a week or so after each meeting, or whenever it seems reasonable, just so everybody has updated information. And then the youth interest survey, I wrote survey. It is not going to be like a giant, big, long survey. It would include things like name, grade, what people want to see addressed, and a space for further input if they have anything else to suggest or ask. This link could be included in social media bios and attached to the bottom of emails. This way there's constant access to it. And it could also be utilized if people want to reach out to speak during public comments. They could put that on the form and we could reach out to them. So just some next steps. If anyone's interested in working on this kind of thing, outreach and communication with the youth of Wakefield, you can shoot Catherine a quick email. And then the next step would be to determine the methods and contact the communications director to work out fine-tuned details. So
Awesome.
That's it. I don't know if anybody has any questions. I can try and answer them.
Yeah, I think we should. I think it'd be kind of cool to go into a little discussion about this, because I think I'm working on there's a bunch of different organizations. We're talking about like students and youth, and social media has been a huge enabler for these organizations to like get more people involved. So I think that's really cool. I think having emails is good. Maybe we can send out like our minutes, like what we have done in the past week or so. I think that is in the past meeting. I think that's a really cool idea. So yeah, I know Canva graphics don't really fit a lot on, so sometimes a longer email is preferred. So it's a good idea.
I think the social media piece is a really good idea because I think it makes us seem a little more approachable, because that's like kind of what people our age are used to is social media and like direct messaging rather than emails. But I do think emails are still a good option. But I definitely think social media would make us seem more friendly and outgoing if we did that.
Yeah, I think the next step is going to be getting to that email, creating an account. We just talk to the town, make sure like you follow all the rules and stuff.
Yeah.
And then we can start posting something, or post like a welcome, and then just like kind of put like the Google form in the bio, be like sign up for our email list here. I think that would be like the best next step. We can like discuss after that. So I don't know You, Catherine, Drew, have anything to say about that?
So when I was talking to Alyssa, she was talking about, because Anthony is also going to be our liaison to the communications department, so if you're interested, just to reiterate, in being part of that outreach team, let me know, and then I'll let Alyssa and Anthony know, and you guys are going to do a subcommittee meeting with our communications director, because she really knows like what's appropriate and what's not, because you are a formal committee. But I think she is, and she's fantastic. We'll learn a lot working with her. So I think your ideas are great, and she'll be able to take your ideas and say, yeah, this is how we can do it. Don't forget, we have the web page on the town website that you guys could upload things. So you could even upload your newsletter to that with Jen's help, and then just say, and then people could kind of click on that to see what you're up to. So that's another venue, but she really honestly will give you some great ideas. But I thought that was a great presentation, Alyssa. So
Yeah, it's great. Thank you.
I think people are going to be really excited to see you as youth outreaching to your peers. And even if you're not part of that communication team, all of you are going to be responsible for getting that information out there and really representing. Jenna's going to be working to represent and reach out to all the other 7th graders, and Emanuela and all the other 10th. You guys are going to be in 10th grade or 11th grade next year? We've got
11th grade.
Graders, a bunch of 12th graders, so working with your peers. So
awesome. I think do you think that was really great? I think Laurel is here, our presentation from the Board of Health, so thank you for coming and being here.
Hi, you guys. I'm so impressed to meet you. Congratulations for all joining the first ever youth council, because we need you. The future is in your hands for sure. I'm so sorry to be late. I was on a Zoom call with my mom, who's in a nursing home, and they gave us extra time, and then I started talking to a sibling. Oops. So Catherine, thank God, texted me. So I need you all to tell me how I can boost my cell service, because I have none in my basement office, but I have excellent Wi-Fi. Oh well. I believe that Catherine just wanted me to talk basically about what the health department kind of does. You guys can type in. I mean, is there anything specific that you want to know? Do you want to know more about what we're doing about COVID, or do you want the big picture?
I think we're talking about. Oh, sorry, Catherine. I think that we were talking about last week. We think that COVID is kind of like our big concern right now because of school and being able to go back to going back to schools. Think that was what we were interested in. If you were able to talk about that.
Laurel, just to let you know, that they had Superintendent Lyons on at their last meeting to give them an update on the school updates. One of the things they were talking about was that, how is the town responding to COVID? How does contact tracing work? What's the health department's role in the response?
Okay.
And then you guys can ask more detailed questions.
So this school, I adopted a parakeet during COVID that landed on my backyard, and he's talking. So it gets annoying. I will, in fact, I think we're gonna take a walk upstairs. So walk with me and I'll keep talking. So COVID, let's just back up to March when we knew that we were going to get in trouble. The town really moved quickly in a response to say, geez, what do we need to know? And the very first thing that we really had to look at was meeting with town members and kind of shutting things down. So even before the Board of Health, in fact, wasn't involved so much as the health director. So we have Health Director Ruth Clay. We have an emergency director, Tom Walsh, who, his timing was great because the town has not always had that role. And and they work together just to say, hey, we've got to contain this thing. So you guys got shut down on the school level, and town offices closed and the library closed. So we call that mitigation, which is just to reduce the risk. Then we had on the thing about public health is, we do prevention, health promotion, and really mitigation when we have a risk. So the thing that we started to do was COVID is, immediately became a reportable disease. So there are other diseases out there that we like to know about. We'd like to know about Lyme disease, cases of measles, a few other reportable, certain clusters of meningitis we would know about. So the way that works is that someone is sick. So say that I had symptoms, I ended up at the hospital, they did a test, I became COVID positive. They would immediately download that into this state link, which would then show up in the Wakefield office because I was a Wakefield resident. At that point, we have one public health nurse who's supposed to be part-time. So you can imagine as cases started coming in that got pretty unruly, because we do two things. We do contact tracing. So we say, okay, you're positive. Can you tell us who you've been with? And they have to then give us a list of folks that they've been with. And then we have to reach out to them by phone and say, we think that you may have been exposed. If you feel sick, you can get tested. Now, remember, we had to keep changing our strategy a little bit because testing was variably available. So if people didn't have symptoms, we would ask them to stay at home for 14 days. That's that quarantine period. We quickly realized we were going to need to help this public health nurse and really ramp up our ability to do this tracing. So I don't know if you're aware, but in Melrose and Wakefield actually work together as kind of a partnered health department. In Melrose, the school nurses actually work for the health department. In Wakefield, the school nurses work for the school department. But both sets of school nurses, because they were pulled out of the school setting, were asked to help us out with all of this contact tracing. So they would do some calls, and then another nurse and myself, Elaine Silva, who is on the board with me and is currently the chair, we would take the final list of people who should be coming out of their quarantine because they were sick, and we would do follow-up phone calls, and we would determine whether or not people were past that kind of contagious period. And that's where I learned a lot about how people were dealing with the actual disease. So, I don't know if you guys are bombarded, but every day I get either the Globe report on the tally of positive tests and deaths, or I can go into another website, and quite frankly, I stopped counting. But on Wednesdays, you can actually look at the town reports, and they're cumulative. So Wakefield is a little bit more than Melrose, but it probably is because of clusters we had in nursing homes, and we have more nursing home beds. What was interesting and I would literally call people. Some of them actually were my friends who were nurses. I'd be like, oh my gosh, how are you doing? And they're like, yeah, I worked at Boston Medical, and I didn't feel great. And some people really, they had mild symptoms. Other people really were down and out. In the same family, some people were awful and still felt awful, and the husband who tested positive never had symptoms. So it really was a real life lesson in hearing about how this went for people. And then I would, just really implore them to continue with all the hygiene, the social distancing, the face mask. One of the folks, I spoke to a mom whose daughter thought she was now immune since she had tested positive. She was visiting a grandparent or something. And I'm like, please no, she has to continue wearing a mask. So in these conversations, I was able to kind of do a lot of health education at the same time. So the first thing was, how are you? How are you doing? How are you managing? Do you need anything? Like, we had some people who just didn't have thermometers. We had some people who didn't have an ability to get groceries brought into them. So we would try to assist with that. So it wasn't just about, we didn't treat people like a number. We didn't sit there and say, oh my God, you need to stay in and don't make us call the police. It was much more, how are you feeling? How is this going for you anyways? I was tempted to sort of do a little study on my own with a grid that talked about symptoms. I don't know if you had heard, but there's definitely this phenomenon where you lose smell and taste. And I had some people who joked with me because it was in March saying that they were all ready for bathing suit season, because when you don't have much smell or taste, you don't eat very much. You kind of lose your appetite. For some of us, that's not a crisis, but for some people, if it was prolonged, it wouldn't be good. So it was interesting to kind of get a real life picture. But these were all phone conversations I had with folks. Most people were really fine with me calling them. I know that there's been some reports out there that people were very nervous about someone from the health department being in their business, but during an epidemic, that is our business. We do need to know about anything that is communicable. So we're kind of, we've been calming down on the numbers such that that big team of nurses is kind of on the sidelines again, and our public health nurses managing things. I think you probably heard that there was a cluster of cases in Melrose, and nod your heads if you know what I'm talking about. I know it's not. so the silver, the good news is, as far as I know, none of those cases got really symptomatic, but it really brings home the risk we have with youth who may not feel terribly sick and are used to being around each other, and how easy it is just to drop your guard. I've gone by youth in parks and they've kind of been swirling masks around their fingers, and I'm like, oh, if we could. It doesn't work if you hold it in your hand. It only works if you put it on your face. And I get it, it's hard to believe that you have to do it all the time. But, if you watch what's going on in the whole country, we are not out of this, and we're not going to be out of it until we have a vaccine. Any questions?
If you guys have a question, oh yeah, thank you for that. If you guys have questions, like your hand thing. But Catherine, what were you saying?
No, I just want to kind of let people know how the Board of Health works. So we have 3 elected board members. So Laurel's one of them, and they kind of advise the health department. So she's a volunteer, that helps advise and guide the health department. So that's what the Board of Health, sometimes you hear the Board of Health and you hear the health department. The health department are the people that work and get paid by the town. And Laurel is an advisor and an elected position.
Yeah.
So
it's an elected volunteer position.
Just like all of you. You guys are all, yeah, they're all volunteers serving our community. Just so Laurel's similar to you.
Does this committee have to be trained on open meeting laws? Is this an open meeting?
Yep, it's being recorded, and we've had, and they all have taken turns presenting on Robert's Rules of Order, open meeting laws. Alex did a presentation on that. So they're learning all about government and their role, because they were appointed by the town council. So back to COVID questions.
Yeah, so if you guys have questions, just do like the raise your hand feature. Some participants need to raise your hand. But I'll go first with the question. So, of course, most of us are students. So, going to school is probably one of our top priorities. Do you know, like, is the town would be able to like provide certain like things for you, like masks and stuff like that, or like do like thermometer checks in the morning? Like, how is that going to work out? Do you know?
So I was not on a call, and I imagine Ruth probably was last week. So along with this came a whole new level of conference calling on our department, to the point where it's hard to actually get your work done, because every time you turn around, you have a conference call or a Zoom meeting. So I don't know what protocol. I need to get back in the loop with the school. So as a board member, as Catherine's saying, we're paying attention to changing policy or making policy as we need it. And then kind of, there are sometimes, especially in these situations, where we just have to get out of the way and let the department staff do what they're doing. So the department staff includes our health inspectors, our health director, who is the one who's doing most of that consulting. And she has her master's in public health and has been doing this for a real long time. So no one's been doing pandemic level ever in their lifetime, because we haven't had a pandemic since the 1918 Spanish flu. But certainly the principles are the same. So we would, and you're, so you're a council, the Board of Health, the public safety, fire, and school often connect. And sometimes, on the other end of the spectrum is going to be the senior center and how they're doing things. I imagine that we will definitely be in a position to augment thermometer scanners and screening protocols. I am not privy to that exact planning, but I will figure that out and get back to Catherine or whoever you want me to get back to, and let you know. So certainly we will be consulted, but the school department is the very biggest budget in town with the most moving parts. It's so interesting. Taxpayers like, oh, it's money on schools. And, I kind of always think of it this way, which is, we have public safety and fires, but we're not actively putting out a fire every day, thank God. Like teaching and education is an active thing. You have to be doing it all the time. So it's a very different structure and protocol.
Thanks, Laurel.
Yeah. Any other thoughts on that?
What other questions do people have related to the town
Andy?
response?
Sort of off of what Jack was saying, has the Board of Health been working very closely with the school committee, especially recently, on a possible reopening plan for the fall?
So the board has not. The board has not. Is they have to figure it out, and then they would call us to consult, and we're certainly happy to do that. But they have even, they pretty much have the same information we have. They just have a whole different scope. And I'll reach out, actually. Who's the chair right now for a school committee? Catherine, do you know?
Amy Purcell.
Is it Amy? Okay. I'm no longer the chair either, so I may have Elaine do this. But just so you know, you guys are a committee. It's probably, what's cool is committee members can reach out to each other, but in order to avoid mass chaos, it's always good kind of for chairs to talk to other chairs. So for instance, if something's going on with town council, I'll connect with my colleague Ann Santos, or I did just last week. I demoted myself, but we just reorganized and gave everybody a different turn. But the chairs would speak the Board of Health only has 3 members, so we can't really have subcommittees. It would be a committee of 1. You guys are a bigger group, so you can have certain subcommittees. School committee is bigger because I believe there's 7, so they have different committees. But I can certainly reach out. But this is really going to be a Doug Lyons as the superintendent with Ruth as the school, as the health department expert and the policy expert, trying to figure these plans out. And unless we need to implement a rule, but I don't imagine that we would, because the school, if anyone knows how to manage policy in this town, it's the school department policies are vast. And so it is appropriate that they're going to, that they'll figure this out with consultation with the health director.
Thank you.
I just wanted to say a couple other things too. Sorry, I'm trying to turn my video back on. I want to say a couple other things too, that as someone, because my office is actually in the health department. I think I was talking to Alyssa when I was answering phone calls. One thing that our health department is doing along with the contact tracing is just advising, like the, if somebody like the Wakefield Little League has a question about how to handle things, or a business has a question, or people aren't wearing their masks in certain business. There's a lot of that going on. So our department's been really busy just following it up and making sure that the policies that were set are enforced and are practiced to make sure all of you stay safe.
And just to go off that, we really hope that by educating people, they'll do the right thing. But I have heard some, misinterpretations of the guidelines, and again, people saying, oh, well, it's a personal decision to wear a mask. And I'm like, no, not in your gym. No, that's not a person, that's not a choice. That's, you can't stay open unless you actually follow this stuff. And it's the only tool we have right now. That's all we have, is for people to be careful. We don't have a magic bullet. We don't have a vaccine. The treatments, I have friends who have been at the bedside with these patients, and I used to do that kind of work in the early part of my career in ICU nursing, and it is, let's just say, when I did ICU nursing, I might have 1 or 2 people out of 10 beds where someone was very sick, but everybody else was in a stage of recovery in their illness. In this COVID case, where they've had to double up ICU beds, I had a friend working at the Brigham, every single patient was sicker than anyone had ever managed for a longer period of time. So my heart is really with my colleagues who are at the bedside. And just because, maybe 90% of the population doesn't have to be hospitalized, this is a crazy illness for those who have the different, more intensive courses, worse than anything else that we've seen. So it's certainly worth preventing for everybody.
Going off that, do you have any information how the town is enforcing the mask mandate? Because I know it's kind of a really hard thing to enforce because it's not enshrined in law. So how will the town enforce
Well,
it?
so we can enforce it in regards to, for instance, restaurants. So we have already done this, where we'll get a report from a citizen saying, I'm really concerned that the chefs are wearing the masks around their necks, for instance. And so that prompts a visit from our health inspector or our health director, where we go in and say, you're on notice. This has been observed. And we have had some people, really get aggravated with us, going, we're trying to stay open. You're going to help us out. And we're like, yeah, well, in order to stay open, you have to follow these rules. And there are monetary punishments for that. We don't have, do we? to look at the regulations one more time.
Yeah, they get a verbal warning, written warning, then they get a fine.
We do, but I'm just thinking of, the person who, so I have noticed a trend, even outside of Massachusetts, that stores, especially stores that are a national chain, have just said, across the board, whether your state has a masking order or not, no mask, no service. And there's been some friction between customers. And it seems that the trend is that people are getting better at this. In Wakefield, if someone is really acting out and being belligerent, we're going to try to de-escalate. We're going to try to hand somebody a mask, or offer an alternative. Like someone at Shaw's might say, all right, tell me what you need and we'll bring it to your car, because we can't, and we do have an exclusion for masks for, kids less than 2, or for people with a health risk. And that's generally around actually a sensation of claustrophobia or anxiety. Most respiratory diseases would tolerate wearing at least the paper mask, and I have different levels of homemade masks at home. And I have to say, there are a couple of them like, this is really probably protecting, but I don't want to wear it forever. So our policy is much more to educate and provide. So the way you might have noticed it went in Wakefield is we were able to do a huge mask drive for seniors one week and implement the mask order, which we did before the governor did. And then we were able to distribute 5 masks to every household in Wakefield soon after that order. So our idea was much more to enable people to do the right thing, not to yell at them for doing the wrong thing. So we're, and still, we're not, I think people in Wakefield are getting it. People are sort of separating the initial good weather in April and in the parade around the lake made me a little bit nervous for sure. And then, you try to change the environment sometimes in public health as a strategy. And so do you know what we did to change the environment around the lake? Does anybody remember?
Did you close off parking?
Yes. So that's an indirect way to kind of change the environment, to bring those numbers down.
Oh, Laurel, you have a few questions, and I know.
Yes, first we're gonna go to Lauren.
Yeah, so I'm not sure if you heard it, but Alyssa did a really nice presentation on communication and kind of outreaching to other youth that aren't involved in this and with the town. So we were thinking about starting up social media and like weekly, or not weekly, but email updates. So kind of going along with what you were saying about the masks and everything, is there anything that we can do to kind of reiterate what the town is trying to do, specifically to the youth, that would be helpful to you guys?
Yes, thank you. And I did come into your call just as you were finishing up on that. And absolutely, I think, one of the things that we do it in the Wake Up Coalition as well is, kind of age group to age group, because I'm not going to tell you what to do. I think the first step is trying to kind of ask your peers, hey, why is it so hard to wear a mask? Genuinely sort of figure that out. And I really, I hated that word peer pressure when I was growing up. I thought it was just like this catch-all thing, but we do tend to mimic the behavior around us, like, oh. And so the first thing, I guess, is to be a good example and go, you know what, I'm doing this. Our risk is low. We're keeping it low. If you have to, make up a story about someone being immune compromised in your house and you just can't take the risk. It's just like how we teach you, or maybe not, but how I taught my kids, listen, what's the story you need me to text you to get you out of an uncomfortable situation? Like, oh, Auntie Carolyn just came from California. Like, you need to come home. Come up with, ways to sort of, figure out what the barriers, like, why is it so hard to wear a mask? Be an example and wear a mask. kind of campaign around being the solution, and things like I care. I mean, there's lots of neat logos, but absolutely we'll take any positive messaging that we can get. And it's funny because I think in social media we all kind of get into our own orbits, and so we're not actually breaking through. Only a certain amount of people read the item, only a certain different groups have access to their kind of own orbit in social media. So the more that you can broadcast positive messaging, and not, we got to get away from the shaming. We have to make these positive and creative. So in other public health campaigns, I've seen things that kind of make me laugh, which at a beach I go to in Maine, it says, if you're smoking, we're going to assume that you're on fire and we'll put you out, kind of thing. Because it's little kids, or young lungs at work kind of thing, so that people won't smoke around playing fields. So slogans that make people think but don't make them feel bad and make them defensive, I think are things that work better. But have at it. I'd love to see some more messaging.
Thank you. Yeah. So our next question, we're gonna go to Maggie. If you guys have any other questions, put your hand up.
So I was wondering, because you said there was like a mask fine. Would you be able to get the fine for putting the mask under your nose? People do that all the time, and it bothers me so much.
So I think the better way to change the behavior, as much as you just want to fix it, because fines just kind of make people angry and more defiant. I think you just say, hey, hey, your mask slipped. Give people the benefit of the doubt. We're not going to get into the business of policing masks. It's just, it will backfire. If we can just, again, demonstrate good mask technique and give people the benefit of the doubt, and just say, hey, I see that just slipped. Oh, thanks. Or, and there are times where I go by that person and I just hold my breath. So there's no exchange. The other thing that I've noticed on social media, I'm hoping that you all know in science how respiration works, and that there's a difference between carbon monoxide and carbon dioxide. And you have a lot of people out there going, I'm not rebreathing carbon monoxide. I'm like, it's not, it's carbon dioxide. It's the stuff that trees do well. So even being sure that people understand basic science would be helpful, because if people, so you understand that carbon monoxide is a poisonous gas that comes off of exhaust from cars. The exhaust that we breathe out is carbon dioxide. It is not toxic. It is part of how we balance the pH in our bodies. And that there is really, in fact, one of the cures for people who are having a panic attack is to re-breathe into a paper bag. Have you ever seen that trick where people go, this, calm down? It's actually just a way for the body to manage our balance. So just make sure that whatever you put out there is factual, and don't, I don't know that you should fight with people, but do try to move people from an understanding of a poisonous gas, which is carbon monoxide, to a product of respiration, which is carbon dioxide.
So if no one else has a question, I'm seeing other hands. I have another one. So I work in electoral politics, and I'm really concerned about election day. So how is the town how's the town preparing for having a wave of people from all over the town going to the Galpin and going into one room?
So I just received my mail-in registration, which I will do. So we're pushing that. Betsy Sharon, who is our town clerk, is the most organized woman in the world, also runs the fastest meeting. So we've already had an election under COVID. Well, first of all, we did town meeting, which I thought went pretty well considering. The only thing that if we ever have to do it again, I would maybe add some lucite and, actual clear barriers in front of speakers, because for people who are hearing impaired, it's hard not to look at someone's lips. But the town clerk is invested in, and has been on a movement to do early voting. So that's already a mechanism to keep the crowds down on election day, and then mail-in ballots. So the more people who avail themselves to those two ways of voting, the more we bring down the density on actual election day. I have not been brought into any particular plan. Again, that would be between the clerk, Steve Mayo, and they would have a conversation with the health director and the emergency director. But Catherine and I will keep our ears open in regards to how that will go, for sure.
And Laurel, I just wanted to let you know one thing that's great about the youth council too, is every single one of them is a liaison to a different town board or department. So actually Thomas,
I say, Tom, put your picture back on. There you go.
there, yeah. Tom's the health department, and we have school committee representation, police, even conservation commission, lots of different boards represented here. So that's a nice piece about the youth council. So
Yep.
Tom, we're going to be relying on you to communicate what's going on with the health department, any other updates too. So
Yeah, and Tom, maybe you can be in charge of remembering these questions and poking me every so often, because I swear to God, I don't know, as I age, it's like whoever's on fire in front of me gets my attention. But and I'm a student again, so I feel I feel for students. It's quite a challenge to do this online learning, for sure. I kind of need the teacher.
Mm-hmm.
But
Totally.
I am figuring it out.
So
Also,
then,
that side look stuff.
so then I have any other questions, because it's 4:02. I don't want to take up too much of her time. So any other questions? No?
thank you,
Awesome.
Laurel.
Thank you, Laurel. Thank you so much.
My
Really
pleasure,
appreciate it.
guys. You take good care.
Awesome.
I'm
Bye.
looking
Thank you.
forward to your social media.
Yes.
All right. Bye-bye.
Bye. Okay. Well, that was awesome. It was really cool to hear from her and hear about the council response to COVID. That's on our mind, always. So now I just want to go and just figure out our next meeting date. Let me just go into my calendar. So today is July 22nd. So our next meeting date would be not until August 5th. Does August 5th work for everyone? So you want to check your calendars.
So that's 2 weeks from now.
Yeah. Oh no. So no, my bad.
Do we want to
August-
do 3 weeks?
Do you want to do? Okay. Yeah, let's question you guys. Do you want to do 2 weeks or 3 weeks? Because we're doing every 3 weeks. But I don't know if you guys want to do 2 weeks or 3 weeks. Like, anyone have an opinion?
It doesn't really matter to me. I can do either.
Okay. Like also because I know a bunch of people here do band. I don't know like if band camp is doing anything in August, like at the beginning of August, and when.
I mean, Laura and I are the only ones doing band, I believe, so we're kind of a minority here. But band camp does start on the 10th, and that's 12 to 9 each day, Monday through Friday, for the next the week of the 10th and the week of the 17th as well.
Okay, so that means if Laura and Anthony were going to be here, we have to do August 5th. So I think I have the best option just for now, just so we have all three of us here. So is that okay with everyone? Okay, I'm going to write down August 5th.
Thank you.
Yes. Great. So is there any other business we haven't talked about? Anything you want to discuss? Catherine, do you have anything?
Well, Lauren, you can go first, and then.
All right, thanks. So me and Alex and Jenna are the liaisons to the school committee. And I know me and Alex are, I'm not sure about Jenna, but we're going to be attending the next school committee meeting on the 11th. And so I know we still have a lot of time, but if there's anything that you'd like us to ask or bring up in the meeting, you can shoot one of us an email.
and I can make a list of it.
Is the meeting in person or online?
I believe it's a Zoom, just like this. So, I mean, you can attend also, but if you'd rather go through one of us, then you can feel free to ask.
That's going to be a very long meeting.
Yeah.
Yeah, and remember, you guys that are going to board meetings, I know, William, are you going to the planning board soon?
Yeah, on the
Okay,
28th.
so yeah, I know a bunch of you have meetings coming up, and some of your, William might have to listen to like them talking about one building structure for 4 hours. You guys don't have to stay for the whole thing. Just jump on at the beginning and introduce yourself and say, oh, I'll just be here for a little bit. Do not feel obligated to stay there for, sometimes those meetings can go really long. So just to be aware. Any interest in any other hearing from any other departments or anything, or do you want to just kind of next meeting spend giving updates on your departments?
Yeah, I think it'd be cool. If anyone has any updates, just either shoot me or Catherine an email just saying you guys want to talk about it. So because I definitely want to hear from everyone and do a little presentation on what your department's doing and how we can how you can assist them and how you're sharing our voice. So I think that's our goal of this whole program. I think cool is the little tiny updates from the first few weeks. That'd be cool.
Yeah, so maybe who are some people that will be meeting between now and the next meeting, either attending a meeting or talking to their department or committee? Because maybe we can get up. So Emanuela, who else? Ollie,
and it's Lauren. It's going to one. Alice going to one.
Lauren, you guys aren't until the
11th.
Yeah, so it'll be the next meeting after.
So maybe we just do 3 of you. So let's see, we've got Emanuela, Allie, anyone else attending a meeting?
I just attended a meeting.
Oh,
Yeah.
Yana did. So maybe Yana, you could give us an update too.
Yeah, I know she wanted to come and talk about the Warrior logo and talk about that. So
Yeah, I also want to talk about that next meeting because there's a huge petition going around Instagram, so I want to talk about that next meeting as well. I want to put that on the agenda.
Okay, so Anthony and Jack, and so it makes sense that we have Emanuela on the Housing Authority, Allie on the Conservation Commission. That's your liaison, yep. And then Yana on the Human Rights Commission. She's going to specifically talk about the Warrior logo. So that can be the body of our meeting, hearing from those 3 and having some discussion around it.
So do we think we need a person to come next week? You think we're all set with those 3 people coming? I think 3 medium-sized presentations will be a good hour. Yeah. So that's exciting. I'm really excited to hear from all of you. I'm really interested in the Warrior logo. I know it's a big part of town, but it's pretty controversial. So yeah. So does anyone have anything else? If not, do I hear a motion to end the meeting until August 5th? Motion. Come on, guys.
I motion.
Lauren, do you have a second?
Second.
Also, okay. All those in favor say aye.
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 All opposed? Say nay. Unanimously passed. So we will see you guys on August 5th at 4 p.m.